Have you ever wondered how the average life expectancy in Africa compares to other continents? It is a question that can reveal a lot about global health disparities, economic conditions, and the overall quality of life in different continents. Hello everyone, welcome to our discussion on life expectancy in Africa. What is life expectancy? Life expectancy is a statistical measure of the average number of years a person is expected to live based on their year of birth. It is influenced by various factors such as healthcare, sanitation, education, and lifestyle choices. In this video, we will be focusing on the current life expectancy in Africa and how it differs from that of other continents. In the grand scheme of global life expectancy, Africa has historically found itself on the lower end of the spectrum. This is not a statement of doom and gloom, but a reflection of the challenges the continent has faced and continues to grapple with, including diseases, poverty, and lack of access to quality healthcare. However, it is important to note that Africa is not a monolith. The continent is home to 54 countries, each with its unique set of circumstances that influence life expectancy. For example, the life expectancy in Seychelles, an island nation off the coast of Africa, is significantly higher than that of Central Africa, a landlocked country in the heart of Africa. When we contrast Africa's life expectancy with that of other continents like Europe and Asia, the gap becomes more apparent. European countries on average boast the highest life expectancy globally, with many citizens living well into their 80s. Asian countries like Japan and South Korea also rank high on the list, thanks in part to advanced healthcare systems and lifestyles. Please subscribe, like, and hit the notification bell to stay informed. Health is wealth, and information is key to long life. As of 2023, the average life expectancy in Africa is about 64 years. This is lower than the global average of 73 years and significantly lower than life expectancy in developed regions such as Europe and North America. One of the main reasons for this difference is the high prevalence of infectious diseases such as lower respiratory infections, HIV/AIDS, malaria, and tuberculosis in Africa, which significantly reduce life expectancy. Another factor that affects life expectancy in Africa is access to healthcare. Many African countries have limited healthcare infrastructure and resources, making it difficult for people to receive proper medical treatment. This is especially true for those living in rural areas where healthcare facilities are scarce. As a result, preventable and treatable diseases often go untreated, leading to a decrease in life expectancy. In addition, poverty is a major contributing factor to the low life expectancy in Africa. Many Africans do not have access to clean water and sanitation, which increases their risk of diseases such as cholera and diarrhea. Nutrition and lack of education also play a role in the poor health outcomes and shortened life expectancy in Africa. Developed regions have a lower fertility rate and a high percentage of elderly people, which contributes to a longer life expectancy. On the other hand, African countries have a higher fertility rate and a younger population, which lowers life expectancy. Despite these challenges, there have been improvements in life expectancy in Africa over the years. In the past 2 decades, the life expectancy has increased by almost 10 years thanks to advancements in healthcare and technology, as well as efforts to combat infectious diseases. So in conclusion, life expectancy in Africa is still lower than the global average, but the gap is slowly closing. Factors such as disease burden, access to healthcare, and poverty greatly influence life expectancy. It's important for governments and organizations to continue working together towards improving these areas in order to increase life expectancy and improve the overall health outcomes in Africa. Thank you for watching. I hope you learned something new today. Until we meet again, this is Street Science. One story, one street at a time.